A parliamentary delegation that assessed the situation of nodding syndrome in northern Uganda has found new cases contrary to what the Minister of Health, Jane Ruth Acheng, told the country recently.
Many a times, cases of epilepsy and other conditions that affect the nervous system, like febrile illnesses, inborn abnormalities, or autism, have been wrongly labeled as nodding syndrome.
The team found 222 nodding syndrome victims in Omoro district, with 60 cases having been recorded since January.
From January to date, to last week when we came back, can you imagine, there was nothing like a clinical examination. They were not examined by the health department in Omoro.
The MPs also discovered that in Padel, 553 cases had been recorded by the district leaders and health officers, yet there were no rehabilitation centers for the victims. In Omoro and Kitgum, all the centers had been closed.
We were actually asking government to construct some of these centers. You can talk about the three in each district. For example, like we have in Omoro, we have in Kitgum, then we have in Pade, then we have somewhere, maybe Lamo, as a way to have these children who are critically sick to be rehabilitated and supported.
According to the chairperson of the delegation, Ngora MP David Abala, they also found out that some nodding syndrome victims had been raped and defiled. Their report revealed that 44 cases had been recorded, with 4 perpetrators sentenced to 35 years each.
We made a call to all the magistrates who handle the issues of the nodding syndrome in Northern Uganda. The suspects, those who defile, we said should be given a heavier sentence, more than 35 years.
Abala told NTV that although over 4 billion shillings had been allocated to the ministry to handle the syndrome since 2016, only 12 million shillings had been sent to Omoro district, 157 to Padel, and 119 for Kitgum. They are now calling for an audit into the ministry's handling of the funds.
The Ministry of Health should be audited by who? By the Auditor General, including the districts. Especially, we are talking about Kitgum. There are so many queries there.
On Thursday, as Parliament approved a 1.2 billion shillings supplementary budget for nodding syndrome interventions, the Acting Information Minister, Chris Baryomunsi, noted these accountability issues.
So I would beg that if there are questions of accountability, to check whether the money was received by Ministry of Health, released by Finance, that can be at another stage, because all of the money which we appropriate as Parliament is audited.
The Select Committee's report will be tabled for debate when Parliament returns from the Easter break next week. Herbert Ziwa, NTV Weekend Edition.